I'd first like to introduce my audience. This is Haley and Kelly. Today, people are more health conscious than they have ever been. You have probably walked into a restaurant or some form of establishment and seen the hand sanitizer stations and wondered if they even work. My two sources are a systemic review on the effectiveness of alcohol-based hand sanitizer by P. Willawallen and Comparing Hand Sanitizers to Hand Washing by Diane Clark. Alcohol-based hand sanitizer is just as effective as hand washing because it increases compliance to hand hygiene and decreases the rate of infection. Hand sanitizers increase compliance to hand hygiene. According to a study conducted by Clark, there was a 25% increase in compliance with healthcare workers using the alcohol-based hand sanitizer in the hospital setting. The easy use and accessibility makes it more appealing to use. Even within the school systems, P. Willawallen discovered that students were more likely to utilize the hand sanitizer as they were walking out the door to go to lunch or coming back from the restroom than washing their hands. It is also less time-consuming. In Clark's study, she stated that with 100% compliance, using the alcohol-based hand sanitizer would consume 3 hours of nursing time compared to 16 hours of nursing time if you washed your hands. The hand sanitizer also reduces skin irritation and dryness compared to normal hand washing, which also makes it more appealing to use. Hand sanitizer decreases the rate of infection. Clark stated that when testing the alcohol-based hand sanitizer, there was a 99.9% reduction in the bacterial colonies. It reduces the skin burden of bacteria much more effectively than soap and water, and the amount of bacteria on the skin tends to remain lower for much longer than when soap and water is used. The sanitizer also showed that it was more effective in reducing MRSA, which is an easily transferable virus. In the study conducted by Willawallen, there was a 31.1% decrease in absenteeism within the school systems because fewer children were getting sick after implementing the use of the alcohol-based hand sanitizer. So in conclusion, alcohol-based hand sanitizer is just as effective as washing hands with soap and water because it decreases the rate of infection, and with its easy use and accessibility, it makes it a more desirable product to use.